Good morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward, and bringing you greetings from the Lake Providence Health Ministry. We want to remind you, especially now, to continue to be vigilant regarding the health habits that we practice to slow the spread of COVID-19. We are out and engaging more than we have been since we're in phase 3 of our reopening here in Nashville. We're also trending upward in the number of new cases that is seen actually across the country. According to Dr. Michael Caldwell, the director of Nashville's Public Health Department, case rates have increased as follows. Case rates for young children ages 0 to 17 increased by 93%. Case rates for young adults from age 35 to 44 increased by 23%, and case rates for those aged 45 to 54 increased by 32%. Most of the increase is believed to be due to school-aged children and their families. But interestingly, the cases are not traced to the classroom, but to extracurricular and other activities. Examples of those activities are as follows. 17 cases from universities or school setting, such as school sports. 12 cases from a karaoke bar. 10 cases from a religious service, and not the one that you heard about outside downtown last Sunday. 13 from a private party of 7th grade students from private school. And just this week, 4 cases from a wedding, September 26th, and 4 additional cases from another wedding, October 3rd. 5 cases associated with another religious event, not the one we just mentioned, and 32 cases involving students and staff at a volleyball tournament. Dr. Lisa Piercy, Tennessee Commissioner of Health, says that in the last 45 days, the average age of those with COVID-19 is about 43 years old. That's up about 10 years from the upper 20s to the low 30s. That's when we were seeing the people who were becoming infected the most. Now the age is around 43 on the average. Most infections are now in the age group of people who are at higher risk rather than our college-age students. The average age of those hospitalized with the disease is about 70 years old. Also, the death rate in the rural population is double that of the urban population. With every 10 years of age and with every comorbidity, our risk increases. Even though Nashville has loosened the reins and opened a little bit more, we must continue to wash our hands, wear our mask, and watch our distance. Precautions are being taken at the polls if you vote in person. But remember to go vote, but do your part to protect yourself and others. And remember to clean your hands when you leave the facility. Also, remember it's time for flu shots. We encourage flu shots, especially this year in the midst of the COVID-19 pandemic. Won't help COVID-19, but it will help to decrease the amount of disease we have from the flu, and maybe even the possibility of getting both of those infections at the same time. We'd like to remind you of our 4th Saturday mini-series on October 24th. That's this coming Saturday, next Saturday, at 10 a.m. on Facebook Live. This month will be a discussion of breast cancer by Dr. Robin Williams and her panel of experts. You don't want to miss this. Breast cancer affects both women and men. It also affects both young and old. This is Breast Cancer Month and the time when most of us get screening mammograms. So there, let that be your reminder. Now, I've reminded you of about 4 things. What are they, you say? Well, I'm glad you asked. Number 1, be vigilant and continue to wash your hands, wear a mask, and watch your distance. Number 2, remember to go vote. Protect yourself and others while at the polls, and wash your hands when you leave. Number 3, this is Breast Cancer Awareness Month. Time for yearly mammograms. Number 4, flu season begins in October. Time for flu shots. We remain in prayer for you, and we ask that you do the same for us. As always, be safe, be healthy, and stay prayed up. Have a blessed week. Thanks for joining.